About all of that after. For now, the Prime Minister of Canada, I imagine he also has a message ahead of Easter long weekend coming up too.
Hello everyone.
Good morning.
I'm
I'm very happy to be here this morning with Ministers Haidu and Anayan, as well as Dr. Tam and Dr. No.
We have a lot of ground to cover this morning, so let's get right into it. I'll begin with vaccines. This morning, I visited the vaccination clinic at the Nepean Sportsplex here in Ottawa. It was great to see more and more people getting vaccinated. People were in a good mood. A lot of folks were there with their elderly parents. Everyone was chatty and focused, but quite frankly, it was the amazing volunteers who were working so hard who really encouraged us all, and we saw smiles on everyone's faces. I also had the chance to chat with a few of the many healthcare workers who are part of this vaccination effort. They're all doing an incredible job during this really tough time. My job as a politician is usually go around shaking hands, so that wasn't the challenge that we got to do. There was a number of older folks who I needed to remind that an elbow bump is the way we do it. But we're all figuring out how to navigate through this, and the fact that so many people are getting vaccinated is a really good thing. Our frontline workers have given up a lot to stay safe. Last week, I spoke to nurses from the Victoria General Hospital in Winnipeg. They shared what this past year has been like, caring for isolated patients in serious situations, sometimes being their only point of contact, and holding an iPad or holding their hands through a window while family members watch through a window. It was incredibly difficult, incredibly challenging for healthcare workers across the country, even more so when it comes to the fears that on returning home, they might be bringing home this disease to their families. It's been incredibly stressful, but they continue to step up every single day, and all of us need to make sure we're doing the best we can to keep them from getting overwhelmed and overloaded with new cases. But everything they do makes them the heroes of this pandemic. Présentement,
Right now, our greatest priority is to make sure that as many Canadians as possible be vaccinated as quickly as possible, and we are working unrelentlessly to achieve that goal. To date, we have delivered more than 6 million vaccine doses to the provinces and territories. This week, we will receive our greatest number of deliveries to date with 3.2 million doses. This includes deliveries expected from Pfizer and Moderna, as well as 1.5 million doses of the AstraZeneca vaccine, which we will receive today from the United States.
As we've been saying for months, and as we've been planning with the provinces and territories since last year, the end of March will be followed by an increase in vaccine supply. We now have handily exceeded our promised target of 6 million doses delivered before April. And this week, we begin our ramp-up phase. Throughout April and May, 1 million doses a week are scheduled to arrive from Pfizer alone, plus Moderna, plus AstraZeneca. And for June, we have good news to share this morning. Pfizer has now confirmed that they will be moving up 5 million doses from later in the summer into June. That'll bring our total from 4.6 million to 9.6 million doses for that month alone. Of course, that's in addition to the other doses of the Moderna and AstraZeneca vaccines that we'll also get. A lot of doses being delivered means a lot of people who are able to get their shot. If you haven't had your vaccine already, it might be your turn or a family member's turn soon. If you want to learn more about vaccine safety and effectiveness, there'll be a Facebook Live event tomorrow where Dr. Tam, Dr. New, and other experts will answer Canadians' questions directly. To attend or get more information, go to the Healthy Canadians Facebook page. Today, I also want to talk about where we are with the virus and what that means going forward. In some places, cases of COVID-19 are holding steady or even going down. And especially in long-term care homes, vaccination seems to be making a real difference in protecting people from outbreaks. That said, hospitalizations from COVID-19 remain high, and case numbers are going up in many regions here in Canada and around the world. Variants of concern, which can spread more easily and make people even sicker, are increasing quickly. In BC, where the number of cases had been under control, they're now having to put in place new restrictions for the next 3 weeks. I want to extend my full support to Premier Horgan and to all premiers across the country as they make tough decisions to keep people safe. As we have since day one, the federal government will have their backs and do whatever it takes to save lives, to protect our frontline workers, and to support jobs and businesses until we get through this. Il ne reste que quelques jours avant le début de la fin de semaine de Pâques.
Easter weekend is just a few days away. Jewish Passover started last Saturday. It's now the second year in a row that these celebrations are taking place during a pandemic. Unfortunately, this means that we must continue being very careful. Unfortunately, last year, we saw cases increase after similar holidays, like Thanksgiving and Christmas. So it's important for us to avoid an increase in case numbers after Easter if you want to continue the spring in the best possible position. I know it's disappointing, but we need to avoid gatherings. This is not the time to travel. Continue wearing your masks, washing your hands, and using the COVID Alert app. Mass vaccinations are progressing well. Beautiful weather is around the corner, but we need to continue our efforts for a while. With the increase in cases in some regions and the new variants, we cannot let our guard down. As we continue our efforts to protect Canadians, let's not forget that the pandemic has widened inequalities throughout the world and has most affected vulnerable populations. Together with the Secretary General of the United Nations, Antonio Guterres, the Prime Minister of Jamaica, Andrew Holders, and several global meetings, we had a third meeting on development financing. Yesterday, we discussed concrete solutions to help the countries most affected by the current economic crisis, particularly as it relates to over-indebtedness and international aid. We need to tailor our economic systems to better respond to urgent global issues like extreme poverty, inequalities, and of course, climate change. Canada will always be there to listen and to act, and we shall certainly raise these issues with our upcoming discussions with the IMF, the World Bank, the G20, and the G7.
This pandemic, we have to make sure no one gets left behind. Yesterday, Ministers McKenna and Monsef announced $250 million for transit in rural and remote communities. This fund is part of the unprecedented public transit investment we announced last month, and it is the first federal fund dedicated to rural transit. This is part of our job to create jobs and fight climate change. It's also about building more inclusive communities where seniors can get to their doctor's appointments and where people of every age can get the services they need. Before I end today, I want to say a few words about Easter and Passover. Again this year, we won't have the kinds of celebrations we were all hoping for because we just can't afford to let our guard down. I know I've said the same thing before every major holiday over the past year, but this time, what's different is that even if the end of the pandemic is in sight, the variants mean the situation is even more serious. We're entering the final stretch of this crisis. We just need to stay strong a little longer. More and more vaccine doses are coming every week, so there's reason to be hopeful. So please, keep yourself and your loved ones safe. Now is not the time to travel. Avoid gatherings and parties, and continue to keep your distance. I know it's not easy, but together we will get through this. Merci.
Thank you. I'm happy to now give the floor to Minister Anita Anand.
Good morning, and thank you for joining us today. By the end of this week, Canada will have received approximately 9.5 million doses of approved vaccines from 3 manufacturers, Pfizer, Moderna, and AstraZeneca. This is well ahead of the 6 million doses that we had originally projected for the first quarter of this year, with 3.2 million doses arriving this week. The work to accelerate the delivery of doses continues every day.
As the Prime Minister just announced, Pfizer-BioNTech is again accelerating deliveries to Canada with an additional 5 million doses arriving in June. Canada will receive at least 1 million doses of the Pfizer-BioNTech vaccine every week from now until the end of May, and in June, that will be 2 million doses a week, every week.
Pfizer-BioNTech is again accelerating deliveries to Canada with an additional 5 million doses arriving in June. Canada will receive at least 1 million doses of the Pfizer-BioNTech vaccine every week from now until the end of May, and in June, that will be 2 million doses a week every week. Canada was among the very first countries in the world to sign a deal with Pfizer, and we have worked constructively with the company and all suppliers in order to ensure a stable supply of vaccines for our country. Originally, we had contemplated approximately 8 million Pfizer doses in the second quarter alone. And now, due to successive negotiations with the company, we are set to receive close to 18 million doses of Pfizer by the end of June. This means millions more additional doses available to be administered to Canadians by the first days of summer. We said that when vaccines were ready, Canada would be ready, and we are, with a diversified portfolio of vaccines. This is why, in addition to the accelerated Pfizer doses, 1.5 million doses of AstraZeneca's vaccine were loaded onto trucks this morning in the United States and are en route to Canada as we speak. We also expect 4.4 million additional doses of AstraZeneca before the end of June. Combined across the currently approved vaccines, Canada is now on track to receive at least 44 million doses of vaccine by the end of June, and very well on the way to having more than enough to ensure that every Canadian who wishes to be vaccinated can be fully vaccinated by the end of the summer.
While this is very welcome news, it does not mean that our government is relenting on moving doses forward whenever possible. Our work continues, as does the work of every Canadian, to remain vigilant and continue to follow public health guidelines.
The Government of Canada will continue to bring vaccines into this country while managing the inherent volatility in global supply chains for this product. We will see through this challenge together. Merci beaucoup.
Thank you very much.
And we'll turn it over to Dr. Tam.
Bonjour à toutes et à tous.
Good morning, everyone.
On the recent safety signal associated with the use of the AstraZeneca vaccine in adults under 55 years of age. But first, we'll begin with an update on the current numbers and trends. COVID-19 activity has been steadily increasing for several weeks, with a rising number and proportion of more contagious variants driving epidemic growth in many areas. To date, over 970,000 cases of COVID-19, including 22,900 deaths, have been reported across Canada. Over the past week, there have been an average of over 4,600 new cases and 26 deaths reported daily. The ongoing increase in infection rates is now playing out in our hospitals, with rising trends in severe and critical illnesses placing renewed strain on the health system. Over the past week, an average of over 2,200 people with COVID-19 were being treated in our hospitals each day, representing a 6% increase over last week. Over 660 of these people were being treated in intensive care units, which is 14% higher than last week. Most concerning is the continued increase in number and proportion of variants of concern that spread more easily and increase the risk of severe illness outcomes. Over the past week, there has been a 64% increase in new variant cases. To date, over 9,000 variants of concern cases have been reported across Canada, with a B117 variant accounting for over 90%. New variant case numbers represent the tip of the iceberg, as there are thousands more cases that have screened positive for problematic mutations. Yesterday, Health Canada issued a statement in relation to new data on additional cases of a rare type of blood clot known as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT, which occurred following the administration of the AstraZeneca vaccine in several European countries. To date, no cases of VIPIT has been reported in Canada. Nevertheless, as the data on these additional cases could change the risk-benefit assessment, Health Canada, as regulator, has put in place additional terms and conditions on the authorization of AstraZeneca vaccine in Canada. In the interim, Canada's National Advisory Committee on Immunization has recommended to pause the use of AstraZeneca vaccine for people aged under 55 years, pending a full risk assessment by Health Canada. Chief Medical Officers of Health have considered NACI's recommendations and have issued a statement outlining a unified decision to take this precautionary measure. I know that this is another difficult development in the seemingly never-ending twists and turns of this pandemic, but there is a point of grace. I couldn't have said it better, so I would just like to quote Dr. Menaka Pai, Associate Professor of Hematology and Thromboembolism at McMaster University, who notes, strong global vaccine safety surveillance rapidly picked up this rare and serious adverse event. Collegiality, academic rigor, transparency, and medical science will help us manage it. As spring begins, warmer weather and as important religious observations such as Passover, Easter, Vaisakhi, and Ramadan are upon us, we too must do our best and remember our duty to protect one another. COVID-19 activity levels are different depending on where you are in Canada, but there is a risk of introduction and rapid acceleration of cases everywhere. Please continue to follow local public health recommendations, stick to safer ways we've learned to celebrate during COVID-19, and save gatherings for a better time in the future. Despite the hurdles, we are getting closer every day, and we're stronger and more united for it. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone.
Nous allons aborder le récent
Today we'll touch on the recent safety signal associated with the use of the AstraZeneca vaccine in adults under 55 years of age. But first, we'll begin with an update on the current numbers and trends. COVID-19 activity has been steadily increasing for several weeks, with a rising number and proportion of more contagious variants driving epidemic growth in many areas. To date, over 970,000 cases of COVID-19, including 22,900 deaths, have been reported across Canada. Over the past week, there have been an average of over 4,600 new cases and 26 deaths reported daily. The ongoing increase in infection rates is now playing out in our hospitals, with rising trends in severe and critical illnesses, placing renewed strain on the health system. Over the past week, an average of over 2,200 people with COVID-19 were being treated in our hospitals each day, representing a 6% increase over last week. over 660 of these people were being treated in intensive care units, which is 14% higher than last week. Most concerning is the continued increase in number and proportion of variants of concern that spread more easily and increase the risk of severe illness outcomes. Over the past week, there has been a 64% increase in new variant cases. To date, over 9,000 variant of concern cases have been reported across Canada, with the B117 variant accounting for over 90%. This includes 8,381 B117 variants, 358 P1 variants, and 270 B135 variants reported to date. New variant case numbers represent the tip of the iceberg, as there are thousands more cases that have been screened positive for problematic mutations. Yesterday, Health Canada issued a statement in relation to new data on additional cases of a rare type of blood clot known as vaccine-induced prothrombotic immune thrombocytopenia, or VPID, which occurred following the administration of the AstraZeneca COVID vaccine in several European countries. To date, no cases of VPID have been reported in Canada. Nevertheless, as the data on these additional cases could change the risk-benefit assessment, Health Canada, as regulator, has put in place additional terms and conditions on the authorization of AstraZeneca vaccines in Canada. In the interim, Canada's National Advisory on Immunization, NACI, has recommended to pause the use of the AstraZeneca vaccine for people aged under 55 years, pending a full risk assessment by Health Canada. Chief medical officers of health have considered NACI's recommendations and have issued a statement outlining a unified decision to take this precautionary measure. I know this is another difficult development in the seemingly never-ending twists and turns of this pandemic, but there is a point of grace. I couldn't have said it better, so I would just like to quote Dr. Menaka Pai, Associate Professor of Hematology and Thromboembolism at McMaster University, who notes, strong global vaccine safety surveillance rapidly picked up this rare and serious adverse event. Collegiality, academic rigor, transparency, and medical science will help us manage it. As spring brings warmer weather, and as important religious observances such as Passover, Easter, Vaishakhi, and Ramadan are upon us, we too must do our best and remember our duty to protect one another. COVID-19 activity levels are different depending on where you are in Canada, but there is a risk of introduction and rapid acceleration of cases everywhere. Please continue to follow local public health recommendations. Stick to the safer ways we've learned to celebrate during COVID-19 and safe gatherings for a better time in the future. Despite the hurdles, we are getting closer every day, and we are stronger and more united for it. Thank you.
Thank you, Dr. Anu. Now we'll turn to questions from media. We'll start on the phone, and after we're done, the ministers and doctors will be available once the Prime Minister leaves after a few questions as well. Operator, over to you.
Thank you. Merci. Première question, Raymond Fillon, TVA. À vous.
First question, Raymond Fillon, TVA. Thank you. Good morning, Mr. Prime Minister. During an interview last week, you said it will take some time talking about the next elections. If your budget is adopted in the House of Commons, will there be no possibility of triggering elections in the spring? Answer. As I said from the very beginning, my priority is overcoming the COVID crisis and continuing to make sure that there is a strong economic recovery. That is our priority as a government. And of course, in a minority parliament, we never know what is going to happen with the other parties. As I've often said, we need to focus on this pandemic together. We all need need a parliament that is working. We need to continue delivering to help Canadians and to ensure economic recovery. Question, considering that we are right in the middle of a second wave in many provinces, Ontario, Quebec, many experts describe it as alarming. We are not out of the woods yet. Will it be responsible to organize elections this spring? Answer. Let's remember that our democracy is strong and we shall manage, but it is certain that what I prefer is that we continue to work directly to help Canadians, to deliver measures to help families, to help small and medium-sized enterprises, and to make sure that we also fight climate change while we are fighting the pandemic. There are many things we need to do as a government. We are focusing on that, of course. It takes a parliament that continues to function, but I do hope, I also hope it's also the priority of other parties to work for Canadians and not for their own political purposes. Thank you. Next question.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line is open.
Yeah, good morning, sir. I'm wondering, with the system that we have now in which Health Canada approves vaccines and then NACI makes recommendations, in this case of the AstraZeneca vaccine, it seems to be showing some confusion and some hesitancy, having Health Canada say a vaccine is safe for all groups, but then having NACI say that it should only be used for people over the age of 55. I'm wondering if you think fundamentally the structure maybe isn't fit for a pandemic, even if it works during normal times.
I think what we saw yesterday, Ryan, was all the different levels of organizations of experts coming together, whether it was public health officials across the country coming out with a coordinated statement, or Health Canada and NACI working together to ensure that there is coordination in the messages. Look, I understand how challenging this can be for Canadians. The science is evolving as we get more and more data. Experts are refining and shifting their recommendations. Canadians need to know that every step of the way, there is one thing driving all these experts, and that is keeping Canadians safe and getting through this pandemic as quickly as possible. That is the underlying element to every recommendation, to every decision that is put out there. And I can tell you that the work that is being done is extraordinary, not just here in Canada, but coordinating with people around the world. The bottom line for Canadians is the right vaccine for you to take is the very first vaccine that you are offered. The more we get Canadians vaccinated quickly and safely, the quicker we'll be able to get back to a semblance of normality. With the variants that are more severe and more transmissible, increasing around the population, we need to make sure we're doing everything we can to get through this.
Follow-up, Brian?
Yeah, so just as a follow-up, on the issue of vaccine hesitancy overall, you know, we've seen reports that in some long-term care facilities, only 60 or 70% of the staff are taking the vaccine. Toronto actually had to put a big push to get people into vaccine appointments last week. Are you concerned now that we have this flood of vaccines coming, are you concerned about hesitancy and about not getting people to take them quickly enough to end the pandemic?
I think it's certainly something that is on our mind. We know that the way to get through this is to get as many people as possible vaccinated, and that's certainly our focus. But we're seeing, as I saw this morning at the vaccine clinic here in Nepean, people are positive and enthusiastic about getting vaccinated, and I think people understand that the way to protect us all is for people to get vaccinated. But maybe I'll turn to Dr. Tam for the thoughts on your first question and on the hesitancy question. Teresa.
Yes. On the first question, there are different roles for the different groups, but as the Prime Minister said, we worked lockstep, each playing its role. So Health Canada, being the regulator, triggered a signal to the manufacturer to say, we need more data. We need it to be broken down by age and sex to look for this more serious and rare side effect that is being seen following immunization, even though we haven't seen it yet in Canada. With that, while the data is being gathered, we amassed experts from Canada, but also had experts from Germany providing with their first-hand interpretation of what this clotting with low platelets entity is like and some of the underlying scientific explanations. With that, the National Advisory Committee on Immunization looked into that and said, you know, while we're waiting for this information and more information to come, we've seen enough of the science, but also what we've seen already coming out of the European countries to say, take the precautionary approach. And given the data that we've seen, where most of these rare cases occur in the under 55s, that's the recommendation they have provided to pause offering the AstraZeneca vaccine for this age group for now. And then all the chief medical officers got together, having heard all of this as well, and made a unified position to take this precautionary approach. So that's how that all worked together. But all of it had to be done really quickly. And so I think you've seen that at play yesterday to take the precautionary approach to keep Canadians as safe as possible while offering a safe and effective vaccine.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Mélanie Marquis.
Mélanie Marquis, La Presse. Thank you. Good morning, Mr. Trudeau. It's somewhat difficult to find common ground on procurement. Yesterday, with the prohibition of AstraZeneca for under 55s, today you are saying that there will be more doses from Pfizer in June. Could you please tell us the objective the government set for end September to vaccinate all adults who wanted to be vaccinated? What's the situation? Answer. Thank you, Melanie. As you know, since last summer, we've been signing contracts with vaccine companies even before we knew what vaccine was going to be the most effective. We wanted to make sure that we had a wide variety of vaccines to be better positioned. We said by end November, early December, that we were expecting to receive 6 million doses of vaccines in Canada by the end of the first quarter, that is by the end of March. Here we are end March. Not only do we have more than 6 million doses, but by the end of this week, we will be having more than 9 million doses of vaccines delivered to Canada to be able to speed up the process. So the work we've been doing for weeks and weeks to increase the pace of the arrival of vaccines will continue. And that is what we announced today. By end of May, we will continue receiving 1 million doses from Pfizer per week. But in June, it will be 2 million doses from Pfizer. I'm simply trying to say that by end of June, we will be having more than 40 million doses of vaccines delivered to Canada. And this would place us in a very good situation where we'll be able to say that by the end of the summer, everyone would have received 2 doses. And depending on the distribution of the vaccines by the provinces, it's possible that many people would have received at least their first dose before the summer starts. So we are set to meet our objectives and even accelerate them. But we are working every day to make sure that in spite of the challenges with the companies, production challenges, consultations with companies, we want to make sure that Canadians overcome as quickly as possible. Follow-up question? Yes. Answer. Question. Clarification. In Quebec, it date, 24th of June, was provided. You are not giving any dates. You're talking about the end of the summer. It could be the 20th of September. For others, is the 15th of August. Can you give us a date? Talking about Pfizer doses coming earlier, end of June. I know that you don't want to publish contractual terms. Could you say more about that? Answer. First of all, I recognize that things are progressing well in Quebec. We were very happy to see Premier Legault vaccinated. That shows how well things are going in Quebec and throughout the country. Relating to specific dates, from the very beginning, we said that all adults were going to receive 2 doses of the vaccine by September 2021. At the same time, we do know that many provinces have adopted a strategy of 1 dose for everyone more rapidly. So some provinces may come up with specific dates. Our job is to make sure that the greatest number of vaccines approved by the federal government arrive and get to the hands of the provinces so that people can be vaccinated as quickly as possible. As I said, things are moving well. We will continue working hard to speed up things even more. Let me turn to Minister Anand to say if there are any costs associated to the additional 5 million doses from Pfizer that are arriving earlier, but I don't believe so, but it's up to her to answer that question. Thank you very much. It's the same price per dose for the 5 million doses. Prime Minister, you are right. You are right on the others as well. Thank you.
CBC. Is it possible to say at this point what impact these new restrictions on AstraZeneca are going to have on the overall vaccine rollout? And I guess the longer these restrictions stay in place, is that going to compound whatever impact there is?
I'll turn to Minister Anand, but I can say that our portfolio of vaccines was, from the very beginning, as we've seen, extremely heavily weighted towards Moderna and Pfizer. The fact that we are getting 1 million Pfizer doses every single week over the coming weeks, rising to 2 million a week for the month of June. The fact that the target of 6 million doses for Canadians by the end of March, by right now, was based on Pfizer and Moderna alone, means that we are still in very good situation. But of course, we want to get more doses of more varied vaccines, and ensuring the continued delivery of those doses rapidly, including the AstraZeneca doses, to as many Canadians as possible in the coming months, continues to be our priority. Anita, to follow up on that.
Thanks, Prime Minister. Just to build on that, the advice of the Vaccine Task Force, of course, was to procure vaccines from 7 leading vaccine manufacturers, and the minimum amount of doses was 20 million for every 2-shot vaccine and 10 million for J&J. But in addition to that, we exercised options to purchase additional Moderna and Pfizer doses. So, as the Prime Minister said, we are heavily weighted on Moderna and Pfizer as a result of exercising those options. We have 44 million doses of Moderna coming to Canada overall and 40 million doses of Pfizer coming to Canada overall. And as you're aware, 22 million doses of AstraZeneca. So we are continuing to exercise and see the benefits of a diversified portfolio of vaccines. Yes, we are heavily weighted on Moderna and Pfizer at the current time, but what we use as our baseline is the approval of Health Canada. Once a vaccine is approved by Health Canada, it is safe and effective, and from a procurement standpoint, that means all systems are go to bring those vaccines into the country, which is exactly what PSPC does every single day. Thank you.
Glenn McGregor, CTV News. Prime Minister, 2 weeks ago, we had heard reports about blood clotting issues with the AstraZeneca vaccine, yet you came out and assured Canadians that it was safe, and you encouraged them to go get it if it was offered to them. Now we know that there are concerns about this in younger people. Was it a mistake for you to do that? And do you think will that change the way you give advice about vaccines in future? And finally, what would you say to the Canadians who, based on your advice 2 weeks ago, went out and had that AstraZeneca shot?
The advice given by health professionals, the advice that I gave, was that the right vaccine for you is the very first vaccine that is offered. And Health Canada continues to ensure the safety and effectiveness of any vaccine administered in Canada. As we've seen over the past number of weeks, there are different recommendations and limitations given in as the science evolves. But every step of the way, the recommendations that Health Canada makes and that I and other politicians pass along, because none of us are vaccine experts, but we are there to help amplify the messages by Health Canada that vaccines are safe and effective and that everyone needs to get vaccinated with whatever vaccine is offered to them as quickly as possible. But I will turn to Teresa for follow-up on that. OK, avant de passer, écoutez,
our work as politicians is to think about citizens and reassure them on messages we get from experts and the findings from experts. And what we've been saying for a long time remains the truth, the reality. The best vaccine for you is the very first one you're offered. We want to make sure that we vaccinate as many people as possible, as quickly as possible. Yes, the more we receive data, the more information we will have on possible adverse effects. But experts in Canada and throughout the world are making sure that the vaccines are safe and on the best way of delivering those vaccines to Canada, and that will continue to be our priority. Teresa.
Yes, so the advice on any medication or vaccine can evolve over time. And I think Canadians should be reassured that we have systems in place to detect safety signals and then analyze them. As I've said in my opening remarks, it's actually been quite a remarkable feat of international collaboration and science to try and sort out the initial reports. And I think the change in advice has been because there is now more information and that was made available. And still, even if the events were rare, while things are being worked out, that's the balance of risk and benefit was sort of examined. And that was the position and the advice that Health Canada and the National Advisory Committee on Immunization had provided. Every medication or vaccine can come with rare side effects, which will not be picked up until many millions of people receive the vaccine. The initial clinical trial with tens of thousands will not pick up rare events. So I think the important thing, to emphasize to everyone is that we have systems and checks and balances in place. But please do remember that over the course of the administration of the vaccine to many millions of people in the world, if there should be any new signals, we will be communicating that after a thorough examination. But science will continue to evolve in this space. On those over 55 years of age and over, the balance of risk and benefit is such that, the impact of COVID is much more serious in the older age groups, and that's the concern. We have a rising third resurgence, and with an acceleration of cases, and with the serious outcomes in older populations, when compared to a relatively rare event. That's how NACI made its recommendation as well. And as Minister Nan and the Prime Minister has stressed, we do also have a fundamental base of mRNA vaccine.
Bonjour, Monsieur Trudeau. Louis Blouin, Radio
Good morning, Louis Blouin, Radio Canada. You talked about Quebec, where the operation is going on well. In Ontario, it's not so well. And Premier Ford is saying that they need more vaccines. There are interruptions in vaccine operations. What can the government do to help Ontario, given the very difficult situation? And what may the provinces do on their part? Do they need to tighten measures at this time, as spring is starting? What do they need to do on their part? Answer. First of all, as the federal government, it's up to us to procure vaccine doses, and that is what we've been doing for months. We promised 6 million doses by end of March. We are going to have more than 9 million by the end of this week. So we are delivering even more vaccines than what the provinces expected. We shall continue being there to support them in the administration of those doses where help is needed. So we will continue working as a team. I think that is what Canadians expect. Everyone is focusing on delivery in their various leadership positions, and that is what we're doing. Concerning public health measures, I think it's important for each province to continue taking its own decisions. We can clearly note that there's a serious danger or concern with this potential third wave of new variants, which are more transmissible and have more severe impacts. So the federal government is helping provinces like New Brunswick, which has just introduced a 3-week measure to tighten measures. So we are working with them every week.
Good morning, Prime Minister. Teresa Wright from the Canadian Press. Obviously, we're very preoccupied with vaccines today. What are you telling your children and other young people when they ask you, when will I get the vaccine?
Obviously, we know how important it is to protect the most vulnerable, and that's why our vaccine rollout has been focused on elderly Canadians, on people in remote or Indigenous communities, and of course on frontline health workers. But we are getting closer and closer to the point where we will start to vaccinate more and more Canadians. But the imperative is always keeping Canadians safe. Part of keeping everyone safe is making sure there are increasing percentages of the population vaccinated, because that's part of what allows us to be safer as a society. But in terms of vaccination of younger people, we know there is much data being collected right now. There are studies ongoing. And for the latest on that, I'm happy to turn it to the expert and ask Dr. Tam about what the latest is on when we might know about how and when kids might start getting vaccinated. Teresa. You're on mute, Teresa.
Okay, sorry. The clinical trials, as the Prime Minister said, is on a number of vaccines ongoing. So I think, first of all, some of the trials started in the older kids, the youth, and then some of the younger population under the age of 12, some of the trials have only just started. So it's likely that we won't hear about the youth, the teenagers, until later on in the year, and then the younger kids beyond that. So sometimes clinical trials can go faster, particularly if the enrollment is fast, and if there's actual disease activity in wherever those clinical trials are done. So the timeline's a bit variable, but that's all I know at the moment.
Good afternoon, Prime Minister. Marika Walsh with the Globe and Mail. For well over a month now, you've been asked what you personally knew about the allegations against General Vance in 2018, but instead of answering that question, you've pivoted to say what your office knew. So I'm wondering if today you can clarify for Canadians what you personally knew about the allegations against General Vance, whether you knew about them in 2018?
No, we did not. We knew that there was, my office knew there was allegations that were brought forward. We did not know the substance of those allegations until the Global News reporting.
Hi, Prime Minister. Mercedes Stephenson with Global News. I want to follow up on Marika's question about what you specifically knew. I understand that nobody knew the substance of the allegations in 2018, but your office was aware that there were allegations made. We've asked your office what you knew about that. In the last 2 weeks, they just keep telling us that you have nothing to add. So I want to ask you very specifically today, Prime Minister, did you know about any allegations of any concerns of sexual misconduct, regardless of the content, in 2018 or before and when you extended General Vance's term and gave him a raise?
No.
So what did you know at the time?
Thank you. That concludes Prime Minister's time for, we'll now turn to questions for doctors and ministers. Thank you, Prime Minister.
Okay, and that is the Prime Minister of Canada on this